So a warm welcome from me. Welcome to LBT Women and Non-Binary People's Health Week. This event is focusing particularly looking at health issues to do with sexual and reproductive health and mental health. So I'm really pleased. The events of the week are called Breaking the Silence. So we aim to be here, we aim to be visible, talking about these issues. And yeah, we hope that by doing that, we'll bust a few taboos. And you'll probably hear things that you might not have heard before, and certainly not live streamed. So, really pleased that people are with us, and we've got a great little panel here. We're going to do it sort of informal panel, as if we were sitting on a sofa together. We're not. We're all in each, different houses. But the idea is to be quite informal, and I'll be asking a few questions, and we'll be throwing around a few experiences and ideas. So I'll introduce myself. So I'm Jo, and pronouns they, them, and I'm head of HIV and sexual health and mental health, not sexual health actually. So I'm head of HIV and mental health at Metro charity, which is an equality and diversity charity, and we're really pleased to be co-hosting with the National LGBT partnership. And what I was going to say by way of introduction is, a bit about my personal connection with the issues. Being a queer person for decades now, I have a fairly good sense of how the personal intersects around some of the issues we're going to be talking about. So I'm going to be sharing some personal things, but also working in the charity sector, working to support LGBT folks with health issues. I'm going to be also sharing some sort of more work type examples so that I can bring to life some of the experiences of the clients that we support at Metro. And so hopefully their voices can be heard too. So without further ado, I'm going to ask Delphine if they would introduce themselves.
Hi, Jo. Thank you for using my new pronouns. As some it might have come as a surprise to some of you, but I have changed my pronouns since Tuesday. So my pronouns are they, them, and I identify as queer. I'm really so pleased to be here in this panel. I feel very. I hope that as a professional, I can bring some of my client experience, but also some of my personal experience as a queer person as well. And as you said, Jo, it's very much about being visible. There's so much isolation as a queer person. I mean, I live in a small town in Kent. Queer visibility is non-existent, to be honest. So this feels like a really good opportunity to speak out and share experiences and make it a normality, that we are queer and we experience issues around sexuality, menopause, and hopefully to make it visible and the norm, not the default from heteronormative just sort of environment that we live in as well. I'm also a parent in a queer family, so I'm a single parent in a queer family. So I think I can bring in some of my experiences as a queer parent, but also from what we have experienced as a family and what my children are experiencing. I forgot to say I'm the young person's counsellor at Metro as well. I have, yes, forgot about that, which is the main thing. That's why I'm here mainly. So I'm working with young people aged 8 to 25, but I've also worked with other 25-year-olds who identify as LGBTQI as well. So I'm hoping that all this client experience I have, I can bring it here in this panel today. Yes, so that's it for me.
Thanks, Dan. And now I'm going to ask Evie to introduce herself. Hi, Evie.
Yeah. Hi, thanks so much for having me. Hi, I'm Evie. I use she, her pronouns. I am the youth and schools lead for Greenwich at Metro. So that means I run 2 youth groups for LGBTQ plus young people and support them through their adventures in adolescence in Greenwich and Bexley. And I also deliver a programme about inclusive education to all of the schools in the borough of Greenwich. Before I came to Metro, I am also a qualified paediatric nurse. And so I've worked in healthcare my whole career. And yeah, I think I have personal experience as I identify as a lesbian, and so I've had my own personal experiences accessing healthcare, but I also have a real personal passion. I always wanted to work in healthcare, and I was always really passionate about universally accessible healthcare. And I don't think it was until I came out and started trying to access services that I realised that that just wasn't the case at the moment. And that's not how a lot of people experience our NHS. And so, yeah, I have some stories about trying to change that from the inside, their own experiences of advocating for my young people now from the outside, and yeah, my own personal experiences and difficulties I've had. So I'm really excited to share those with everyone. Thanks.
Thanks, Evie. And finally, Kyan.
Hello, yes, my name is Kyan. My pronouns is she, her. I am a young Greenwich sexual health worker at Metro. Started recently, only in September. So everything I've been doing has been online, but I attend schools and youth clubs to do sex education. We look at consent, healthy relationships, do presentations, workshops. Also, we have dedicated youth hubs over the borough of Greenwich, where we are the dedicated young person sexual health workers. And we also have a one-to-one service where we offer low-level intervention for young people in a one-to-one or small group capacity. Before I came to Metro, I was a student. I went to drama school. My background is in theatre, particularly working with adults with learning disabilities and young people looking at how we can use theatre to explore our sexuality and our sexual health. So yes, that's me.
Great, thanks, Kyan. Okay, so so the way we're going to run it is I'm going to ask a couple of questions, but then we're just going to act as if we're in a coffee bar or something. We're just chatting, so we'll just see what arises. So yeah, we should have a good selection of experiences to share. So the first question I wanted to ask was, well, why do you think that our experience is hidden? So the whole point of this week is that we sort of come out and talk about our experiences. But why do you think, on that sort of personal level, that you're not always hearing about our experiences? Why do you think? What are the factors at play that mean that our experiences are hidden? Anybody fancy having a go at that?
I can have a stab. So didn't say in my introduction, but I identify as bisexual, and I came out last year, so I have a lot of experience accessing like health settings from before I came out and identified as bisexual and since then. And I find that a lot of my interactions and the invisibility comes from being bisexual in itself. It's very much, I've had a lot of reactions that it's kind of, I think I told somebody I was bisexual and they were like, oh, but you're not coming out though, are you? And there was such a, they were holding on so intently to the fact that I still had relationships with men that it wasn't, it wasn't a big deal. It was fine. So I think from my experience, that's kind of where some of the invisibility can come from.
So I was thinking that's almost like you were sharing your experience, weren't you? But then the person sort of seems to deny your experience and focus on the men rather than to just hear that you're bisexual. And I think, it can be a real hidden thing, can't it, in the LGBT community as well, that bisexuality is somehow less talked about than, say, lesbianism. So I'm sure we're going to come back to it, but I'm really glad you've jumped in, Kyan, and, just been, in a way, more visible around that. Yeah, great. Thank you.
Yes, I resonate with you, Karen. Actually, I'm also bisexual, and only came out 5 years ago, and I'm older as well. So, as an older queer person, there's so many different levels, and of shame, and not, we want to be visible, but we really don't want to be visible. I sort of want to, but I don't want to put the spotlight on myself either. Because there's so many awkward questions that could be asked, so many intrusive and intimate questions that people feel they can ask you about how you have sex, who you have sex with. It can be really hard to navigate, I feel, as well. But it's all about visibility as well. But it's easy to go back in the closet, for a little while, to protect yourself, sort of thing, as well, I think.
And can I ask you, Delphine, because you mentioned in your introduction about your pronouns and that you changed those on Tuesday. Do you want to say a little bit about how that came about, if you wouldn't mind?
Yeah, no, I changed them last night, actually. I said, we had a meeting on Tuesday, and my pronouns were she, they. But I had been questioning, my sexuality, my gender identity for a long time. But I have always felt that my gender identity and sexual identity have been fluid and have been evolving all through my life and have changed a lot in the last 5-6 years anyway. And I don't want to be restricted to one gender, one sexual identity. So that's why I call myself queer, because I feel it's an umbrella of what it all represents. But I feel like it's freeing for me to not have she in my pronouns. I'll give you an example of a training I did with gender intelligence, and we were given a gender, and some were given female, male, and some were given non-binary, and I was given non-binary. And I remember at the time feeling the sense, like an out-of-body experience, feeling that freedom, and even people in my group saying, "Are you all right? What's going on?" I said, "Oh wow!" But that was like 4 years ago, and I could not go with it. I've been so stuck. But now I'm not. So that's the story behind the change of pronouns. So it's my coming out day, basically.
I was going to say, I think that was a coming out moment. I salute you. Great. And Evie, do you have a sort of sense of why there's this hiding and hiddenness, how it sort of develops?
Yeah, so I think for me personally, more of my experience of feeling hidden or feel like my experiences are hidden isn't from me feeling the need to hide it, although I completely understand where that comes from in terms of a place of safety and, like Delphine said, not wanting to have those intrusive questions, because I've totally experienced that too. But actually from other people silencing my experience. So when I have recounted stories, so for example, I went to a GP with some symptoms at one point, and their first response was just to send me for a sexual health screen. And I said, I really don't think that's what it is. I don't think I have an STI. And I explained a little bit about my sex life, which I didn't really think I should have to do, but I did a little bit. And I was like, so I really don't think that's what it is. I'd like you to have a look at something else. And I felt really ignored, and they refused to do anything else until I'd had a sexual health screen. And it really felt like they didn't believe me, or like there wasn't, they didn't feel like there was truth in what I was saying. And when I've then recounted that story to other people, it's very like, oh, well, the doctor's just doing their job. That's the easiest test to do. It's the first thing they do. And, I understand that as having been a healthcare professional myself, but I think that silencing of that experience and me trying to explain that, no, that felt like that was a microaggression. That was somebody not listening to me and what my experience is and what my identity is. And I think that's maybe where some of the silence comes from, because not only do other people silence us, but after a period of time of being silenced, we stop speaking because we get fed up. We get fed up of trying to educate others and talk about things all the time when we know that it's going to fall on deaf ears. So that would be my point, I guess.
Mm-hmm. Thank you. Yeah. Any last comments about hiddenness? Any more coming out moments, perhaps?
I think there's a lot in not knowing how you can kind of like, not knowing, it's difficult to know how people are going to react. Like even such small things, like I found myself on the phone to my girlfriend's estate agent today, and I was really hesitant, and they were like, who is this? And I was like, Sarah's partner? Because it's just like, I don't know what response it's going to be met with. And I think we've mentioned before, like, you're so vulnerable in healthcare settings anyway. And if you don't feel 100% comfortable, then you're not going to want to share the full extent of your experience. But then also kind of the exhaustion of having to explain yourself over and over again, when that's not always necessarily everybody else's experiences when they go to GP practices and things.
Yeah, thank you. Yeah. Okay, so I wanted to sort of plunge in a bit and talk about reproductive health. So I read this interesting statistic that we don't really know how many lesbian, bi and trans and non-binary parents there actually are. So we don't actually collect statistics on people's sexual orientation when they give birth or gender identity necessarily. And so I was thinking, this is another hidden area, isn't it? Like, a lot of LBT women and non-binary people really are parents, want to be parents. So yeah, I was just thinking about that, our sort of invisibility around that. And, I was wondering if you wanted to share some of your experiences about that, either experiences of clients or more personal experiences. Look like you're coming in, Delphine.
Yeah, I was just thinking mostly about personal experience and experience of in the queer community and in clients, my older clients as well, that I had before I studied youth counselling. Very much about shame again, DIY conception, which in itself brings a lot of risks because the donor is not being screened, that sort of thing. And a fear of actually going to a fertility clinic and being outed again, being in a waiting room with a room full of heterosexual people, or just having the model of mum, dad, posters everywhere, magazines everywhere of how it all works. It's the conception is penis in vagina. That's it. There's no other. The alternative is not there. It's not visible, so it makes the couple or whoever it is, invisible in the first place. It sounds absolutely terrifying, and I think a lot of people just avoid. A lot of LBT people just avoid going through a route that might not sound safe. It might sound safe medically, but for themselves, not so much as well. My experience of I've had children and gave birth in the hospital as well. At the time, I was a bisexual in the closet sort of person, but I fitted the model of man-woman sort of thing, so that was okay. But I noticed that every single sort of paperwork I had to fill in was so heteronormative. It was very much male, female. Who's the dad? Is there a dad? It's like, who do you put on a certificate? It must be the dad, something like that. And just even giving birth, what is the first thing that the midwife says to you is the sex of your baby? It's a boy, it's a girl. I thought, is my baby healthy? That's what I want to know. I don't care if it's a boy or girl. I'm not painting the bedroom pink or blue or whatever. And everything's very gendered, very, very gendered. I've heard some things are changing around the vocabulary of feeding a baby, that sort of thing. It's not, you can still be breastfeeding, but you can also be just, we're just people as well. Not everybody's got breasts. Not everybody is in the binary of male, female. So it gets very complicated and quite isolating again. So that's my experience. It's not non-inclusive kind of vocabulary and setting, and
and I was really hearing that there's like a lack of representation in terms of resources and information. So not only what people say, when you give birth and when you're filling in forms, but also that there's this sort of dearth of just information about how you could conceive in the way that you want to conceive and do that safely. And I mean, it doesn't feel like 2021 to me. It just feels like why have we not got that in 2021? So yeah, so I'm just wondering, Evie and Kyan, if you've got a sense of that too.
Yeah, so I guess first thing for me is that I don't know if anyone else has recently seen the changes that Brighton and Hove have started to make to their birthing centres, and they're amazing. They're doing so well. So now all of their terminology talks about women and birthing parents, and then they talk about the other parent or birthing partner, and it's all, and they haven't excluded any language around womanhood, which I think they've spoken out that they were really cautious to do that, but have also added in I think that's how they said it, is that it's sort of a gender additive space, is that they wanted to, because not only women give birth and not all women give birth, and I think that's such a positive step forward. And I know that some places, some local authorities in South London have started to talk, in terms of like cervical testing, talk about people with cervixes. And I think spaces like that, we really only need to use anatomy-based language. And I think if we can start to move towards those things, that could be really helpful in making people feel more visible, in making people's experiences more part of the norm, and making them feel like they're seen. In terms of personally, so my fiance and I'd say are right at the very, very beginning of our fertility journey, in terms of we do want to have a family one day, and we want to have children. And a lot of my sort of straight friends, I suppose, tend to be really surprised when I say that actually our fertility journey starts at the fact that we're getting married, because for both of us to be on a birth certificate 100% without having to fill out additional forms, without having to go through a lot of additional stuff, or without somebody having to adopt the baby 6 months down the line, the only way to do that is to be married. And I think a lot of people aren't even aware that this is where we've started the process, because we have to start now and be thinking about it for the long term. We also have to start saving first. We have to have however much money ready. Like Delphine said, if there are options to do like DIY inseminations and things like that, but there's a lot of issues around that. There's an issue that the donor's not screened. Equally, the donor's not signed over parental responsibility for any child that's the product of that sperm. There's so many legal issues with it. But then to go to a fertility clinic, even for their most basic artificial insemination, if both of us, whoever turns out decides to carry, ends up being really healthy, we don't need any additional treatment, we just need some sperm to go into a womb, that's going to cost us like £600 for one go, one time. That's it. And it's just insane that's our preparation just starts so much earlier than our heterosexual sort of friends and other couples around us. And it's really hard to talk about that. I think, being at 25 and a lot of people at the moment at 25 aren't really thinking about having kids necessarily. And certainly a lot of our friends aren't. But trying to talk about the fact that we have started our fertility journey already, because it's so much longer than theirs is going to have to be, potentially. Obviously not for everybody, but that's really tricky and makes it kind of hard to talk about sometimes.
Yeah, much longer and much more expensive by the sound of it. Yeah. Yeah, I didn't know that thing about, if you were both going to be on the birth certificate. That sounds really tough, that you need to make a decision about getting married at the same time as having a baby, and planning all of that in advance, because people don't, do they? We do things less planned often. So it sounds like a real hurdle. So
you have to be married at the point of conception for both of you to be able to just naturally be on the birth certificate. So if you do an insemination at a clinic, you can not be married, but you have to do quite a lot of additional paperwork. So it's the simplest way to make sure that we can do it. Is to be married. So luckily I love them very much anyway, and it was always the plan. So
great, thanks for sharing something so personal, Evie, as well. And I feel like you really sort of cracked something open for us, around the differences in a way that you've had to look at this journey in a really different way. So thanks for bringing that in. And Kyan, do you have any anything you'd like to bring in around fertility?
So I am type 1 diabetic, and I have like regular hospital appointments, and I've recently joined a new hospital, and my doctor was talking to me about whether or not I was pregnant or I wanted to get pregnant anytime soon, because they need to monitor my sugar levels quite heavily, and I have to be within a certain range before it's safe for me to conceive a child. And I said, I spoke about how the fact that pregnancy isn't physically possible, it's not on the cards. And what was really nice actually was my doctor was like, okay, like, thank you for telling me that, but I'm going to tell you how it works anyway. So that is still an option to you, which I think is really important, because it's like, there was the chance for that to be quite dismissive, as in being like, oh, okay, it doesn't matter then. Where instead there was the, okay, so years down the line, like, if you do decide that you want to get pregnant, this is how it works for a diabetic, and this is what will need to happen. And it was actually just really nice having that, and like having that recognition information kind of just handed over without having to kind of pull it out.
Yeah, nice. It's always good to hear sort of, really affirming and sort of positive, best practice kind of stories, isn't it? Because I was very aware, sort of preparing for this panel, that there's an awful lot of sort of negative things that we experience. And of course, we want to talk about those too, but I'm really glad that you brought in something that's really supported you as well, because of course, that is all out there as well, isn't it? That's all part of our experience. So yeah, thank you. So I wanted to just dwell a little bit on some other sort of reproductive health taboos before we move on. And so one of the sort of, well, I've always thought, I mean, I don't know, I'm a certain age, and I very much feel like bisexuality has been marginalised in our community, and that it is a real taboo often to talk about having sex with men, women, non-binary people, different genders. And so, in a way, like, I was thinking this issue of termination and contraception and sort of choice, in a way, around conceiving, and then, deciding whether to follow through with a pregnancy as well. That's one of these more sensitive areas, and we don't often talk about those in society in general, but I think we even more don't talk about them. I think they're even more of a taboo within our communities. So I just wanted to sort of open a space if anybody had anything they wanted to share about that.
I don't mind starting. So I had a pregnancy termination last year, and it was a difficult time, because it was around about the same time that I was starting to come out to my family. I was about to have a pregnancy termination, and I think there's a lot of there was some brilliantly wonderful support. There's always this, I think, what confusion is in, like, pregnancy, like abortion care, like that, aren't just for like straight cis women. Like, and I think a lot of the marketing is an awful, not the term I'm looking for, but a lot of the kind of things around it is very much, it seems that way. So I think that's one thing, is in kind of navigating that space during a pandemic, whilst also in the process of coming out. It was a really odd time. And I think in regards to aftercare, there's just not a huge amount of space for it. You get offered a counsellor who, you speak to once over the phone, and it's somebody who doesn't kind of resonate with your situation at all, because it's just so underfunded. It's anyone they can kind of get hold of, and it's I think it's a difficult space to navigate when you deviate from the cis het norm. yeah, I'm sure I'll have more thoughts, but
yeah. Thank you very much for sharing. Yeah, it's because I think it's always really refreshing when people just talk about their experience, which of course many people share. And I was thinking, you know, sort of statistics wise, young lesbian and bisexual women are more likely to have terminations. They're more likely to have unwanted pregnancies. So I was just wondering, from maybe either your life or your work, you know, the panel, you know, what sort of, do you have a sense of that in terms of what might be happening for younger LBT women and non-binary people around, you know, in a way, access to contraception, but also, you know, why they find themselves disproportionately likely to have termination? It's quite a taboo in itself, isn't it? That because people just associate kind of queerness and lesbianism and bisexuality with not pregnancy and not termination. So I think it's really important that we sort of open the door and lift the lid on that in a way. Any comments about the sort of younger side? Yeah, you want to go for it, Evie?
Yeah, so I guess I'll speak a bit more professionally. Yeah, I certainly wouldn't want to speak to a bisexual experience that I don't hold. I know that we have some wonderful people to do that of their own accord here. But certainly in terms of trying to sort of lift that veil, as so to say, when I'm trying to teach this inclusion program, which I teach at school, so it's all around the new RSE guidance, so relationship and sex education guidance, which asks all schools to make sure that any RSE they're delivering is inclusive. And I'm trying really hard to make sure that they know really what that means, and that it's not just, you know, if you are having oral sex with someone with a vulva, you need to use a dental dam. You know, that's the sort of, I think, as far as some of them ever get. And actually we need to talk about contraception for all people, because contraception is so important, and it is so important that all young people can access that and not feel that they're going to be invalidated or feel fearful of entering a space where they could access contraception. And the only way to do that is to start educating them as soon as you can. You know, whenever we're educating everybody, and we're making sure that they all have that safe space, and all have access to the same information. We know that LGBT young people are at the moment destined to have poorer physical health outcomes than their cis-het counterparts. And, you know, I really think we could do a lot of getting rid of that and, you know, minimizing that difference by delivering some good education in schools where everyone has access to it. Yeah, so that's a big part of what I'm trying to do. But equally, to help schools make sure they're providing some education about same-sex or, you know, differently gendered relationships in terms of when you do want to have a child, like how Kyan had that experience with their doctor. You know, we want young people to know that if they do identify as a lesbian at 13, they can still learn now how they could have a family when they're older. And, you know, everybody can feel the same way, because again, a huge part of the journey that we have started now is because we had no idea what we were going to do, and we don't know how the process works, you know, and as a queer woman, you often have to do so much, or as a queer person in general, I guess, you have to do so much educating yourself about what your future is going to look like and how you're going to build a family. And it's something that other people don't always have to do. And so I think if we can get that into schools, not only would it help LGBT people, but it would also help not have to explain it to your straight friends all the time, because they'd have had the same education, and so we'd all be coming from the same place.
Yeah, thanks, Evie. Delphine, do you want to?
Yeah, so that strikes a chord with me and my children, actually, to be honest, with my experience. Sexual education, oh my God, really. Not very much of it, really. I do remember in year 6, we had an email from the head saying, we're going to be showing this video to your children, okay, about sex education. I was like, oh, good, excellent, good. If any one of you is concerned, you can come and watch it first and then decide whether you want your child to attend or not. I thought, I want to see it. I really want to see what my child is going to be seeing. So I went in. Oh my God, I just giggled all the way, but it was actually quite upsetting at the same time. And I was the only one who was there because I just wanted to see what was going to be shown in a positive way. I was hopeful, I was wrong. Everyone else was there, every other parent was there because they were concerned that they were going to be shown some information or something that with a sexual content, and it was all about man-woman meeting, lots of little hearts everywhere and butterflies, kissing, nothing much else. This is a little bit of a thing going on, but nothing very real, to be honest. And then there was a pregnant lady, yes, giving birth, and it was all happily ever after sort of thing. So that was exactly it. I was thinking, are you joking? And then after that, they separated the classroom with boys learning about sex, so masturbation, that sort of thing, separated from girls learning about periods. And I was just thinking, it's just how the boys, when identify as boys, just going to learn about what's going on for a girl, if there's identified as girls and periods and that sort of thing, and what they're going through, and girls learning about masturbation and what's going on, and do girls not masturbate? I mean, it was oh wow, I thought we're in the Middle Ages here, just the Dark Ages even, just thinking what is going on here? Do I really want my kids to see that? What are they learning from this? I'd want them to unlearn this rather. This is not beneficial. This is actually damaging, because it's not the reality of what life as it could be, for them. And in secondary school, it changed a little bit with where my children went to. There were loads of so with my kids being queer as well, there was some changes have been done in the school with pronouns and changing all sorts of things, and they were very open. They had a Senko that was amazing, a real good role model actually, and I felt that is what we need, role models like that, who understand, who are informed, who are active and proactive, and who are educating the whole school, the staff, everyone as well. So yeah, that's my experience with sexual education. I'm just like it really needs to be so much more there, and and it really depends. It's very much a geography thing as well. It's not very there's not like a program of every single young child as well, from much younger, without it feeling like it's a threat of some sort, just teaching the child what their body parts are. This is a lot of safeguarding attached to that as well. Just anyway, just I could go on about this for a long time. Sure. Yeah.
Thanks, Delphine. So I just want to see, there's a question in the chat which we're going to come back to. So just to let the person in the chat, Alexander, has posted, know that, because I think it'd be a good time to ask this question, which we've sort of veered into in a way. I was thinking, if you could give 3 things to a young person around having a sort of healthy sex life, if you wanted to set up young people in our communities to have a healthy sex life and a positive sex life, what sort of gift would you give them? If you had 3 things that you think are essential to sort of pass on, or because people don't always have, do they, role models in schools, and so maybe like some reflections on what you wish you'd had, or what you would give to a young person in this area.
I can go. I'd say, I think open conversation around pregnancy care and termination. I think that's why I'm just really happy to talk about it and not make it something that doesn't kind of resonate with me. I think it's something that I put something out about it on Twitter, and I got about 3 people who I went to high school with and haven't spoken to in years messaged me about it to talk about oh, I don't know anybody who's kind of been through the same thing, and desperately wanting to speak about it. And I think everybody deserves to have access to that conversation and access to those spaces. And I think in sex education at school, I don't remember hearing about it. I remember thinking, I knew it was an option, and I knew there was a phone number you need to call if you do want a pregnancy termination, and that was it. And it wasn't until it happened to myself, and I did so much Googling, and luckily I have some wonderful friends that put me in touch with somebody they knew, and I had no idea what was going to happen. And I think it's a big thing for your body to go through, and I think the silence on it in sex education is overwhelming. So I think that would be a really important thing. Some really open discussions about that. I'd also say some non-scaremongering around STIs. I feel like everything that I had in high school was, here's the most horrific photo we could find on Google Images, and don't let it happen to you because it will completely ruin your life. And that was it. And there wasn't, any talk about like regular STI screening, because not every, despite what we've shown you on the board, not every STI is going to have symptoms and things like that. And I'd also, my third thing would be more dialogue around consent. I barely remember us speaking about it. I think it was kind of touched upon, but I think consent is often only really spoken of in around sex, and it's really not spoken around that subject very much at all. I think it should be implemented from primary school, and I think if people learn about consent in relation to their whole life, then applying it in sex and relationships is going to benefit everyone, society, a lot more than it just kind of being a 5-minute conversation you might have in year 9. So yeah, those are my 3 things.
Great, thanks, Kyan. Nice and clear. Anybody else got a sense of what you might want younger people to have before they embark on their sexual experiences?
Yeah, I mean, consent for me is just the very main, just like for the thing that really strikes me from my own experience as a young person. Obviously, I'm quite a bit older than you, Kian and Evie, and there was none of it. There was absolutely no sex education. There was a biology lesson at the time. That was it. There was absolutely nothing else. Nothing around consent, of course not. No, and the whole culture of, if you don't out loud say no, then that means you must mean yes, that sort of thing. And I think that's what I like that's what I bring. I think I've learned a lot from my clients, actually, my young people who have gone through sexual assault or rape, or same-sex rape as well, and not believing it themselves. They don't think people to believe them either. And there's such a secretive, shameful thing around it to, it's like doubting themselves or gaslighting themselves. Do I actually did that happen? Is that rape? Is that sexual assault? Is that did that really happen? Yes, it did, but I'm not sure. And to validate that and say, yes, this is traumatic. What happened to you is absolutely traumatic. And having somebody who believes them. It's the first step to recovery as well, but learning about consent, that, and it's not, I'm a counsellor, I don't do the jobs you do, but still, I mean, very much, it's like, that is very much in the conversation all the time with my young people. I think that's so important.
I think that sort of consent is so framed in a sort of heteronormative kind of, even the word, for me, it evokes a man and a woman. And I was sort of reading some statistics this week that the partnership put out, and it said something like 50% of LBT women and non-binary people have had sexual experiences where they didn't give consent and they were assaulted from other LBT women and non-binary people. And partly I think we don't talk about it because we're constantly feeling criticised by other people. and we don't like to criticize each other. You know, we don't like to say, actually, you hurt me, that wasn't good. We don't like to share that we wound each other, and that we're violent towards each other. But it's not really surprising, is it, that we are, given the immense pressure of sort of being constantly criticized, actually, and having a sort of negative stigma around us. So I'm really glad you shared a bit, Delphine, because I think it is, you know, drilling down into our taboo in our communities as well as that wider taboo. And you know, I think it's really rarely talked about. So, you know, what would good consent education be for LBT women and non-binary people in schools? I mean, that would just be really refreshing, wouldn't it? It's and necessary, clearly, given the statistics as well. And the statistics just tell of people's experiences. So if you think, you know, there's 4 of us here, so 2 of us will have experienced that most probably. So yeah, it's pretty vital stuff. But often, if it's taught, it will be taught in a way that has nothing to do with us and our experiences. Which then, yeah, what you're saying is people then feel really isolated when it happens to them, and they worry that they won't be believed, and they can't even sort of get their head around what's happened because nobody's ever told them that it would be possible to happen. And, you know, being young and confused, it's about what's happened is very isolating, I think. I mean, being old and confused also is isolating, but, you know, when you're just embarking on your sexual life, it's, you know, it's pretty, very difficult stuff. So, yeah.
Yeah, so everything that you have both just said has really spoken to me. So I've experienced sexual violence from another woman, and it took me a really long time to understand that and to understand what had happened. Just like you said, Delphine, like self-gaslighting is the best way I can explain it, because I had no words to frame it and no education to frame what had happened. And I'm really lucky I've been able to come a long way with some really fantastic support. But it was really difficult, I think, for all of those reasons. So I guess if I was giving a young person 3 things, I would also agree, definitely consent, and particularly for me, information around coercion as consent, as sort of non-consensual. When I talk to schools, a lot of what we start talking about in terms of, because I think a lot, and I'm sure that everyone's seen it here, is that cup of tea video, and that's classified as good consent teaching in schools, and it's a good start. It starts a good conversation, but, you know, yeah, like we've all said, consent is not just yes and no, and we know that it's not that black and white. So I think coercion is such a big part of that, and I think if we can teach young people about coercion, it also helps start the conversation about healthy relationships as well, not just about sex. I think so many unhealthy relationships start with forms of coercion or manipulation. And so I think that can open such a good dialogue if we can start with that kind of conversation. I would also give them some information about what sex can look like outside of having a penis and a vulva, because I think that's really important for young people to have. That there are loads of different things and different ways that they can understand and explore themselves and the people that they love, and that can be safe and pleasurable and fun, but that it can be done in different ways. It doesn't just have to be that, and if that isn't what you want, that's also okay, and that's fine. I remember a lot when I was a teenager, people talked about, like, I hate the word, but those sort of urges, and I was always like, no, all right. And, you know, when I was 15, I was like, oh no, I'm not interested in boys. I like schoolwork. Hate to break it to myself, just didn't like boys. But, you know, like that, and that was such an experience that I had in all of my RSE sort of experience, was all about how you must be wanting relationships and this is how to keep them safe. And I just didn't really, I was never that bothered. And so it would have been great to have some more information out of that. And completely honestly, the third thing that I would give all young people, and I do whenever I get the opportunity, is lube, because I don't think any of them know how to use it properly and they don't use it enough. And so that's always the thing I recommend we give young people.
Great. It's another taboo, isn't it? I think lubrication, and yeah, all, you know, it's probably what we like see in the media, isn't it? And on films and on porn and things like that. It's yeah, you know, so many people use lube for sex, but it's just like as if it's some hidden taboo that never happens. So yeah, good pickup.
I remember at high school, if anybody mentioned lube, it was an insult. When I was at high school, it was like there was something wrong with you, there was something wrong with your partner, somebody wasn't very good at something. And like, yeah, like speaking with young people now, like I think that that's still there. So yeah, that's a really good point, Evie.
Yeah, just one thing. It's like society just is telling us that we have to be sexual beings, you know, so we have to be ready for it all the time. And otherwise, as you said, Kian, there's something wrong with us as well. But something positive is that, you know, as queers, we're creative. We can be creative with how we have sex and things. So I think that's a real positive thing to tell kids, you know. You know, there are other things. What is the alternative to this? You know, penis and vagina. What are the alternatives? What are you thinking? What would you like to do? You know, with a consensual partner. You know, what is out there? What can you do?
Yeah, absolutely. I think about how, marginalised I now look back and feel by that experience. And I can't imagine how that must feel to somebody who is asexual, or who, you know, that just isn't a part of the relationships they have in their life. And that doesn't mean that their relationships are any less valid, but it must feel so invalidating to have to, go through that sort of an education.
Okay, so I'm going to move us on slightly. So there's a question in the chat from Alexander James Moore, and so thanks very much, tech team. So I'm going to read it out, and then I'm going to say a little bit about it, and then ask the panel if they want to comment as well. So there's a real lack of information about pregnancy risk when dating trans people on hormone replacement therapy, and does HRT reduce chance, and by how much, of pregnancy, and what contraceptives are effective and work alongside HRT? So probably the first thing to say is, so it is a medical question. None of us are clinicians, but we'll have a little go in terms of what we know, and what we, you know, very much sort of give out information at Metro as well. So so I was thinking a few things about this question. So I was thinking a bit about Freddie McConnell, who's a famous trans guy who's given birth, and took it to the High Court that he really wanted to be named as the father or the parent on the birth certificate, and the High Court ruled that he could only be called mother. So actually giving birth as a trans guy, his experience wasn't validated by our legal system and what we write on those forms. And Evie was mentioning, weren't you, about the forms, and that we're a problem apparently for the forms. Our experience is a problem. We can't just get something as simple as being called the parent or the father who gave birth. I mean, that seems really simple to me. I don't know why that's not possible. So clearly sort of invalidating Freddie's experience, and he's been really, really open about his experience as well. So there are, many more trans guys and non-binary people who are trans-masculine or masculine identified giving birth these days and accessing services. So I guess the question's looking a bit at, yes, taking testosterone does reduce pregnancy risk, but it doesn't eliminate it. So if people are taking testosterone, then they can still get pregnant. So most people are advised to also have a contraceptive method. And so what, often when we think of contraception, we think of the pill, don't we? And, it's important to avoid estrogen-based contraception pills. So, many trans guys take a progesterone-only pill, or have something like a Menera coil that just releases progesterone, and it won't muck with the testosterone that people are taking. Some people have coils which are just copper coils, so not releasing any hormones. So for some people, it's really important. They don't want any hormones in their contraception. But progesterone should not cause a problem for trans people who are taking testosterone. And I think, again, it's one of these areas that's a real taboo. So because we tend to sort of binary everything and, just try and keep everything sort of clear and simple. And often trans folks' lives are not simple. Just because you might be masculine identified doesn't mean you don't want to give birth and have a baby. So it's a really great question, and I think it definitely cracks into a real taboo there. So any other sort of comments or things to add in there around? I know at Metro we try and make sure our services are really welcoming, our sexual health services, to people regardless of how they identify, include trans people and non-binary people. So anything anybody wants to add?
I was just going to add with the pandemic as well, with young people having gone back to parents' house, etc., not being at uni, not being with their GPs, not being able to access their medication, etc. I see that with my clients and at home. Young people get in Transmax. Young people just get their periods back on. So I'm just thinking of not just their mental health, but also, the physical health, and if they were to have sex. Young people have sex, regardless. Yes, we're in a pandemic, but people still do have sex as well. That's not stopped, there's further risks as well at the time. But we're lucky at Metro. I'm glad to refer them and just make sure that they know that they have this support as well, and not just mental health wise, but also with their sexual health as well, so that they don't take so many risks as well. Because it's what I found that a lot of the time is especially in the queer community, there's a lot of risk taking with young people, not just young people actually. I'm just saying young people, but no, just all across the board really, when it comes to sexual health, and not referring themselves and being worried about being stigmatized, and so thank goodness we have those services, that are available. But it's just advertising it, as we're here. There is some support. There's other people like you. You don't have to be in isolation. Now, how many young people, young trans people, might be in their bedroom thinking, okay, who can I reach out to? Do I want to reach out? I'm just too worried with my experience in medical service, everything I've had with a gender identity clinic or that sort of thing. Do I really want to just have another layer, of me outing myself and talking about my sexuality and sex and me having sex? It's very difficult. I think we expect a lot for our young people. But there's a lot that a lot of young people are just quite isolated and just would like to access services, but it's just how do we get them to feel confident that they will be safe and they can have somebody who can understand where they're coming from, and
Thanks, Delphine. I was just thinking, I wanted to pick up that thing about risk, and certainly in my teens and my 20s, I took a lot of risks sexually and in lots of other ways as well. And I think, looking back, it's because nobody ever sort of taught me how to not take risk. I didn't feel very good about myself, and I didn't feel confident negotiating relationships and sex. And I mainly got drunk, and I know that happens to an awful lot of people. You can't have a sober date until you're, for me, until I was like in my 30s. And I was just thinking like, I didn't feel good about myself because society told me that I wasn't any good. And so it wasn't like I consciously thought that, I was all out and proud and a queer person, but inside, and unconsciously, I would just sort of act out this risk-taking behavior really. And I think I thought I was invincible somehow, but also I suspect looking back, just didn't know how to care for myself, and also it wasn't like, it's just all a bit jumbled up, isn't it? When you're in your teens and your 20s, it's like I learned later in life, in a way, how to care for myself and what I wanted to do when I was unconfident. Like I didn't want to drink when I was unconfident, and I could sort of sit with that lack of confidence more rather than go and do the things that I did earlier on. And So I think, you know, because our community gets really stigmatized around risk, almost like, oh, why are they doing that? You know, why do they take the risks that they take? And you know, for me, it was like, because I didn't really know any other way. You know, I was just doing my best to be myself, and to, you know, I had sexual needs and needs to connect with people, and I just did my best. But that would probably look quite risky to other people. But it's not like I was being irresponsible or anything. You know, I was just doing my best with what I had, you know, with the hand I was dealt. And yeah, and you know, we've got a really high drug and alcohol taking, you know, kind of thing in our community. You know, much higher than cis and straight counterparts. So I wanted to ask you all a bit about that in terms of your own sort of journey with sort of risk taking, but also maybe drugs and alcohol, and where you feel that sort of plays into sort of sexual health and mental health.
Yeah, I was thinking, I think just kind of like growing up and essentially operating in and around shame, like every single conversation you ever hear about a queer person, there's, even if there is a positive, there is always somebody coming in with a negative, or at least always somebody coming in with a negative comment. And I think with a lot of like your teachers in school growing up underneath Section 28 and things like that, it feels so shameful that when you're finally in a position where you know you're not living at home, you can go out, you can meet people, you are going on dates, it's overwhelming, it's daunting, because nobody's taught you, like you said, Jo, no one's taught you how to do it. And if you've been operating kind of underneath and around all of this shame, and then you've got all of these opportunities now, how is that shame making you feel, and how is that kind of factoring into the risks that you're willing to take? And I found personally, to do with self-esteem, I partook in things that I necessarily didn't want to do, because you're looking for validation and you're looking for somebody to tell you that it's fine. And I think that's where a lot of risk taking can come from.
Yeah, shame is another thing that's so difficult to talk about, isn't it? So I'm really glad you were very bold in naming that, and a very sort of inner experience in a way, shame, but then it makes us act in certain ways, doesn't it? And yeah, it's a really key thing for our community. Yeah.
Also, very quickly, I just think, is going back to sex education, there's such a lack of resources. If you're a cis heterosexual person going through like state school sex education, when it comes to being a queer person, it's not spoken about. There's even less. So when you get into when you are dating, when you are having sex with people, it looks like to others that you may be partaking in really high risk behaviors, but you've not been taught how to not to partake in high risk behaviors. And I think that kind of coinciding with really low self-esteem and trying to work yourself out and understand yourself and kind of get to grips with who you are and what you like, it can often that's where risky behaviors can come from, I think.
Thanks, Kyan. Want to come in, Delphi?
Yeah. This is a very painful thing for me to talk about, unfortunately, coming out at like age like 38, 39, 40, like progressively, not really, but a bit, but you know, to some, to not really, and starting work on Metro at the same time, and just not being out, and then being out, and oh gosh, it was just a struggle. It was an inner fight within myself with risky behavior. I felt like everything I would have done you know, from 18 or something that I suppressed, I just went for it, and I drank a lot of alcohol to the point where I put myself at risk quite a few times, which brought shame. So we go with shame and lack of validation. So, you know, going into relationships where maybe I would be told, well, when you were straight, so are you a lesbian? Are you this? Are you that? And trying to label me when I was still trying to work out who I was, you know, and a lot of ageism as well. So being older. So how did you not manage to work this out when you were younger? You know, it's all very damaging. I find it really upsetting and very damaging. And I'm only, because I've had my own therapy again with a queer therapist this time as well. And just to work this out, you know, how damaging these comments were, these mini aggressions were, from somebody I thought loved me, you know, and that's really, and I'm still working through it, because I just thought, even talking about it, I find it quite very upsetting, really. I didn't have enough self-esteem and to think, hey, that's not okay, actually. No, I shouldn't be treated this way. Why these comments are not okay? But I think this need to be validated and to be part of the community really took over my own self-esteem and who I am, really, who I was at the time, really. So that's why I'm so big on consent, and just, you know, and I see that with my young people as well, you know, that I work with, very much, am I trans enough? You know, so-and-so told me this, my boyfriend, my girlfriend told me this. Am I queer enough? Do you think I'm gay? Do you think am I? Is that okay for me to not know? Is that okay for me to be questioning? You know? And yes, of course it is okay. And that could evolve throughout our lives anyway, you know. It's just but it can, I think, if young people are aware of that, no, you're just young people, older people as well. I'm being ageist now. No. Anyone to be aware of that, and then that they are valid, and, you know, it's like exactly non-binary as well. It's just being so, you know, it's still in progress. You know, the validation of what is it really, and people asking intrusive questions. What does this mean? Who are you? That we will never dare ask a heterosexual person, you know, when did you find out you were heterosexual? How do you have sex? You know, you know, we don't do that, really. So yeah, risky behavior. Yeah, and I'm glad, you know, that my children have learned from that. Actually, I've taught them that it's, you know, to value themselves, and that their queerness is celebrated at home at least, and how to make themselves safe outside of home as well. Yeah.
Thank you, Delphine. Okay, so I wanted to move on just to another. I suspect we might come back to talking about younger people again, but I want to specifically talk about older folks too. And there's also a question in the chat about midwifery and care for queer folks. So we'll come back to that. So we'll just pause that. Emily has asked that. We'll come back to that. We won't forget it. So yeah, I wanted to just ask about issues to do with the menopause. And I was really interested to read a person called Tanya Glide has just recently produced some research on queer folks and the menopause. And, you know, one of the things that really struck me was, I think she sort of quoted something that said that the menopause is seen as a pantomime, that it's, you know, joked about and laughed about, and, you know, really pointing to that stigma that older women, middle-aged women, can feel around their bodies, how much they're in touch with their own desire, how much they're projected onto by people and made invisible. So yeah, I was wondering, I think there's a kind of whole area in here about, well, you know, in a way, what can we do to discuss as sort of slightly older folks what our sex lives are like with the onset of the menopause, and then going through the menopause and after the menopause. Because I think, again, when you say the word menopause, you don't always think LBT women and non-binary people. So you just sort of look through, again, a much more heteronormative kind of cis-normative lens. And so yeah, I was just kind of getting that sense of, oh, this is another area where we sit alone with, don't we? We sit in isolation with our experiences. Maybe we discuss them with like one or two partners, say, but really, you know, are we able to talk to our doctors about any help we might get? Do we see ourselves represented in any of the resources? How do we feel about things like loss of libido, vaginal dryness, moods? So yeah, there's that whole sort of area of sort of slightly later life and menopause, but which we very rarely talk about. So anybody got any? I saw Delphine was nodding. I think you've read the research from Tanya as well, which is great. And so do you want to kick us off maybe, Delphine? And
Oh God, I know. I watched. I was so kicked off. I watched a podcast as well and all sorts this afternoon. I got led astray, and so we're talking about people with ovaries, really. So that just engulfs just much more than just cis women, obviously. And I think I might be going through perimenopause. So that's the length of time before you go into menopause. I think so I'm 45, so it's people with ovaries, age 40 plus, but they can be much younger as well. One of my friends went through menopause, mid 30s as well. So, but it's like it's such a taboo and it's such a secret, Okay, I can't sleep. I've got anxiety attacks, I feel really hot all the time, I just like, I just got to take just and then there's something else is going on in my body that is not what I used to be like. Lack of control on what is going on in this body. It's hormones raging, there's hormones. What is going on with hormones, and how much my mood could be affected as well. But there's very little being said about, queer women in and menopause, but also the assumption that it's all going to be negative. That it's all negative as well about menopause. I've heard so many queer women tell me this is so empowering. This is it. I don't have a period anymore. It used to be so dysphoric. Now I feel that yes, I can have sex when I want, if I want. I don't feel like a shackles to this having to have sex either as well. So there's a lot, there's it's not binary at all, actually. There's just a huge spectrum of what's going on with menopause. But I guess for some people menopause can be associated to femininity as well, which could be super triggering. And as working with people who are trans or non-binary, we forget about neurodiversity and what menopause means to people who are neurodiverse as well, that sort of thing. So no, we're not here for the lecture or anything, because I'm just having all these ideas, but talking about personal experience of people I've seen around. But a lot of people are really reluctant to share that. It's like the shame of not having sex anymore, not wanting sex anymore. As I said before, we are supposed for society to be sexual beings, so what's happening? So it's a loss. It's like no wanting sex, loss of libido is a loss, but it might not be. It might actually be a relief, to not having this a high sex drive or a low sex drive, just for it to be released from it as well. But it can be also, I mean, personally, it's very, very personal. I just feel like it would be a loss to me. But I think we'll find new avenues, of what it would look like, in different circumstances, and there's plenty of things that could be accessed as well as a queer person. And it's just probably just opening your mind to, okay, this is a different stage of my life, okay, and grieving for what used to be, or maybe taking little bits that used to be there and just moving them forward with some things that could be useful. And we go back to lube, that sort of thing, and also one thing I was thinking about as well is that also trans women can have effects of menopause as well, can have the symptoms as well, but that is completely forgotten and just pushed aside. This as well. There is nothing. There's no. I've looked everywhere. I don't know if any of you have any more information, but there's no information, no statistics of anything. And also, you know, thinking about a person who goes to gender identity clinic and they are taking, for instance, testosterone. Do they go to the GP and say, I'm going through the menopause? How is that going to work with hormones one way and the other? You know, do I tell my GP? Do I tell my gender identity clinic? How does that work with the balance of hormones? You know, are the two going to be combined? You know, going through the menopause and my transition, how is that going to be combined? How is that going to work? So I'm asking more questions than answering anything, really, to be honest. Yeah, so these are things I had on my mind.
Thanks, Delphine. Any other comments from Kyan or Evie? You want to come in?
Yeah, so I think for me that the phrase that was sort of talked about around the menopause, I can't remember the exact phrase, but like around it being like a caricature or like something that's that's this like cartoon of, you know, an older woman fanning herself, and that's it, I think comes from such an entrenched misogyny that everybody who isn't a cis man is a fertile woman or is irrelevant. And I think that means that, you know, experiences around, even just around periods, you know, and around like when you go through your teenage years and you start getting your periods, around when you have periods, as you know, in the fertile years of your life, and then when you go through the menopause, it's just completely invalidated, and you never see any of that. And I think I wasn't prepared for supporting women around me as they go through the menopause, how physical and how, you know, whole body changing that thing is. And, you know, that like Delphine said, you know, people with ovaries, it's beyond words. You can't explain what it is that your body goes through in that time. And it isn't, you know, just, you know, hot flushes here and there. You know, it's hot flushes that make you faint and that take over your whole body. And it's not, you know, it's not a hot that a fan will get rid of. It's a hot that radiates from your inside out and makes you want to throw up. And, you know, and I don't think that really like visceral experience is ever seen, and so then no one's ever prepared for it. And whenever it hits you as a person with ovaries, you're shocked and terrified, and one go through all of those thoughts of like, oh well, is this normal? Is this what everybody feels like? Maybe I'm overreacting, or maybe other people don't feel like this. Is there something wrong with me? When actually it's a completely normal experience for anybody who has a set of ovaries, but it's just never seen. And I absolutely advocate that we need to talk about it more. Like you say, it's such a taboo, and I really think we just need to start taking that down.
Thanks, Evie.
Yeah, I was just going to jump in and say, I think going back to sex education for young people, I don't understand why there isn't a session on menopause. I don't think it was mentioned. One of my science teachers mentioned it passing by in a joke form, and that's the only time I had it when I was at school. And I think it would be, going forwards, a really important thing to include in young people's sex education. And I'll say something I think you mentioned earlier, Delphine, the gendering of sex education, the idea that all boys go into one room and all girls go into one room. And actually, yeah, I think it would be amazing to see menopause education for, you know, every young child in school settings.
Great, thank you. So I wanted to move on, and I wanted to talk a little bit about experiences of accessing care, and it sort of, so healthcare mainly. And there's this question in the chat that I think sort of ties in, but I just sort of want to bring the question in, but then I want to ask a wider question, because I think it probably will come up. So the question from Emily, is there any advice you would have for a midwife in providing better care for LBT women and non-binary people during pregnancy and labour? So it sort of opens the door, doesn't it, to the idea that our healthcare providers really do affect us. We have relationships with them, no matter what their identities are. And because like one of my answers was like, get a lesbian midwife. That would be a good thing to do for LBT women and non-binary people during pregnancy and labour. But you don't always get that luxury. So maybe I'll ask the panel. Do you want to share some examples of maybe positive experiences you've had, which have been sort of queer affirming, LBT women affirming? But also maybe share some experiences where you've thought that was a bit lacking and you'd wished that, in a way you'd had a different type of care. So maybe that feeds into this question of like, what advice would you give our healthcare professionals about how to look after us in an appropriate way? So there's probably about 5 questions I've just asked you, so that's very complicated. But basically, we're going to go ahead and share some experiences about healthcare, the positive and the negative. Anybody want to kick off?
So I think my first response, I guess, to the question at hand, the first thing I always say to people in general is, as a healthcare professional, have a real think about if the question you're about to ask is because you need to know it for a health record or because you're interested. Because if it is just because you're interested, don't ask. I think we've all talked about it differently, but I think a lot of us have experienced intrusive questioning and about things that we have wondered, why did you need to know that? And I know that it's something that and other queer women that I know who have had pregnancies, as soon as they announce that they're pregnant, they're always met with, oh, so did you have IVF? How did you do that? And you would never ask straight couples that that. You would never ask if they've had IVF or how they've had fertility treatment. And so just in general, if it's something you need to know, fair enough. And maybe even explaining that to the people you're talking to. But just really have a think about whether or not that question is necessary or out of, sort of an internal interest. An interest is fine. And being interested in wanting to educate yourself is great. But just don't use your patience to do that. Not that I think that you do, not that I think that other people do, but it's an experience I've had. In terms of my own experiences accessing healthcare, I guess both my most positive and most difficult ones have been accessing mental health support for myself. So a big, the big turning point for me is that a lot of mental health professionals earlier on, when I tried to access healthcare, wanted to pin a lot of the struggles I've been having. So I struggle with anxiety around my sexuality. And my sexuality isn't something I would say I have struggled with. I wouldn't use that word to describe my experience with it. I didn't understand it for a bit, and then I did, and that's it. I'm really lucky that I have a fantastic family who are really, really supportive. I never even came out to my parents as such. I just brought home a girlfriend, and that was kind of it. And I'm so lucky to have had that experience. But it means that my attachment to my identity is really comfortable. It's never been something that's caused me any trouble. But a lot of mental health professionals have wanted to reduce me to that and have wanted to talk about my coming out experience, or was I bullied at school? And that's just never been an issue I've wanted to talk about, because it's not been an issue. But my current therapist, who I work with, is absolutely incredible and just never has even brought it up. Every so often we talk about my relationship with my fiance because we're talking about my relationship, but it's only ever in that context. She's never asked me about my sexuality. It's just never come up, and I've really appreciated that. And I think it's what has helped us sort of build the working professional relationship we have now. So I guess that's some positives and negatives. I think my biggest negative is that because I am a fertile cis woman, whenever I go to the GP, I always have to go through, you don't have any contraception on your prescriptions? No, I don't. Are you sexually active? Yes, I am. Are you trying to get pregnant? No, I'm not. Then you need contraception? No, I don't. And every time, it's exactly the same conversation. I could repeat it for you verbatim because I've had it every time, even if I just want to get, I went to get my refill of my antidepressants, have to go through it every time, and it's so boring and so frustrating.
I had a tip, Evie, because at some point when everybody asked me those questions year on year, I think I just, whatever the first question was, I just said, I have a female partner. We're not trying to get pregnant. I'm not taking any contraception.
Yeah, I think I just need to start going in and saying, I'm a lesbian, stop it.
Yeah.
It's just so frustrating that you have to do that, like this whole rigmarole.
Yeah, I think eventually if you do have that confidence, you get bored of it and you think, right, I'm going to circumvent that whole thing. I don't need to fill in the form. I'll just tell them what they need to know. But it's, that sort of speaks, doesn't it, to assumptions, like we're assumed to be cis and heterosexual often, as if there were no sexual diversity in the world or gender diversity. And it's that assumption, isn't it, that leaves you cold. I know I find it a real trigger if someone assumes my partner's gender or assumes my sexual orientation, and because they never assume that I'm queer. And they never assume that I have a female partner, and so it's always the assumption of the majority, and then I find that really wounding, because our lives aren't seen, and they're not celebrated, and they're not seen as the norm, whereas they are the norm, aren't they? They're us. They're what we live, and so what would you do with all those forms and all those professionals? I was thinking, how could we give better education so that people, they don't assume things and they're more open. What do you think?
I really agree with Evie. Sorry, I jumped in. About kind of only asking questions if they're necessary, but also being not kind of like diverting round the question and it being a bit awkward and uncomfortable, like just ask. If it's a question that is necessary, just ask. And I think I experienced a lot of that when I was receiving abortion support. And then there's conversations about contraception, and I say, oh no, I'm not going to need any. There's an immediate assumption that I'm carrying out risky behaviours, and I don't know how to look after myself, when actually, if they would have just kind of taken the space to say, oh, why not? I could have said, I'm in a relationship with a woman, and then that there doesn't need to be this whole, I think it's just being direct and being frank and being open. You don't know what that person's situation is, and just stop assuming that you know the general experience.
Thanks, Kyan.
For me, assuming assumptions and that's my pet hate word. Oh my goodness, just because I look a certain way, you look a certain way, you're assuming I have a husband, assuming I've got this setup. It's just I struggle with it. So unfortunately my experience has not been great. I can think of a good one for one of my kids, but I can't think of a good one for myself. So I'm thinking of when I had my coil removed a year and a half ago. For me, my coil was very much a symbol of heteronormativity and me forcing myself into relationships that I didn't want to be in. So for me, it was very important to do that. It took me a while to make the appointment, and got to the appointment, and I was asked so many intrusive questions about myself, my sex life, who I was having sex with, how long ago did I have sex with a man, what sort of relationship I'm in, how long for. And I thought, do you need to know that? I mean, are you filling a form that's asking all those things? And if it is, how wrong is it? And I was so frightened, actually. I was so I just answered, and I felt like a rabbit in the headlights. I felt outed. It was so traumatizing. All I wanted was my coil out. I just wanted that done and leave. That's all I wanted. I wanted somebody who would be caring, who would do the procedure, as best as they could, and to have some and to care after myself afterwards. And instead, I had a barrage of questions and then I was tested for STIs and stuff, which was fine. I wanted to. I said, okay, well, I'm in the sexual health clinics, fine, okay, good, that's fine. But then he would so emphasize on, am I sure I want to do this? What if I have sex with a man again? Or because I'm a man, could be a trans woman, I don't care about body parts, I really don't, but it was like not said, but it kind of implied, that might be the case, sort of thing. So it was kind of insidious, and there was something that was just really, it was plain traumatic and unpleasant. And even talking about it today, and I've talked about it when we met on Tuesday, and I was just, it brought back all these feelings of feeling, well, not consensual, actually, being asked those questions and things, and in a way that and I feel like, why is it me? Should I not have answered them? Do I really have to? But at the time, I felt I had to, because I wanted my coil removed, that sort of thing, which is all very, very unhealthy. And it's putting me off going back to the surgery completely. It's really putting me off going back to the sexual health clinic for anything, because I'm just afraid of these questions. Are they going to ask me again? They've got me on record now. They've got everything on record now. Can it not change? Is that everything set in stone? So since last time I went, a lot of things have changed. Is that who I am now on record? Is that yeah? And I'm just wondering, with young people going through those services, not Metro obviously, but other services that might not be so educated and just simply LGBTQI friendly, what could they be the experience of vulnerable young people as well? I mean, I'm an older person, quite resilient and stuff like that, but thinking about younger people, that might be their first experience of those services, and how is that going to affect them in the long term?
Yeah, thanks, Delphine. Thanks for sharing your traumatic experience as well. I'm really sorry to hear that. Yeah.
Thanks so much for sharing that, Delphine. And yeah, I guess I just wanted to build a little bit in terms of things healthcare providers I think that can be done, and this is particularly around the care of trans and non-binary people. So a lot of the work I do with my young people is a lot of advocacy, and in general, I would just always say that if you are in a healthcare setting, having to make a decision, or having to put something on a form, having to complete something, where you're having to document somebody's biological sex, and you have a trans or non-binary person in front of you, have a conversation about it. Like Kyan said, tell somebody that's what is going to have to happen. If there is enough reason that you actually need to put it on, and have a conversation about it. Because I think I am aware of a trans young person who attended a hospital, and on their wristband, their sex was put as unknown, because the person completing it just didn't know what to do and didn't want to do the wrong thing, and so just went with that. And actually, that was so dehumanizing and such an upsetting place for that young person to end up in. And if somebody had a conversation, something I always say to schools is that trans and non-binary people know better than anyone the difference between gender and sex, and know when it is and isn't relevant. Ask them. It's their lived experience. It's their lives. Just ask. Just have a conversation about it. I always think that's just the best route to go. And yeah, so don't make decisions for people because you think you know what's best. I think we all know that we can only speak to our own lived experiences. And so yeah, just don't make decisions for people when you could have a conversation about it.
I think that's a real example of I was thinking the sort of about the colonial roots of the NHS and the huge hierarchy in the NHS, and we've got this whole thing, haven't we, about the NHS being sort of open to all and fair and accessible. But if you talk to any marginalised groups in society, Black and minority ethnic people, people with disabilities, people who are neurodivergent, LGBT folks, it's like we all know that coming into contact with this huge sort of system and this huge hierarchy where sort of doctor knows best, and you're not necessarily that assertive with your healthcare providers, it doesn't do anybody any favors. It's the system is built on sort of a sense of structural inequalities, and it has a colonial and a racist past and present. And so I was thinking like it's not a neutral system, the healthcare system, to engage with, even though I think the narrative around it is that it's somehow neutral and open and fair for all. So I think I would sort of somehow like to bridge that divide between, it isn't an easy system to engage with in the relational, and it's not easy for the staff, and it's not easy for the patients either. So there's something about sort of having more creative conversations and embedding a culture where change can happen, and where we can feel more empowered. I was really struck a few years ago. I saw a presentation at the British HIV Association conference, and it was a great study that somebody had done on asking people with HIV if they wanted children. And there was a whole study. Of course, it's mainly sexual healthcare that HIV clinics sit within, and but nobody had ever asked anybody who was HIV positive, pretty much, in the subset which we were looking at, which was LGBT people. So we're looking at LGBT people who had HIV, and nobody had ever asked whether they wanted children or not. And of course, there are loads of different options for folks to conceive and have babies that don't have HIV. It's a really big success story, but nobody in the system had actually thought, oh, we do actually need to have these conversations. And it links to there's a question in the chat about, how do you start to have a conversation with a health advisor and starting a family if you're trans and non-binary? And I would say it's like, just for a lot of people, that's an issue. How do you actually discuss if you want to have children or whatever it is that you've gone to your healthcare provider for? How do you actually have a proactive conversation rather than a sort of reactive one, where you feel on the back foot and you can't ask for what you want? So really interesting study that I saw presented, just like, and it really busted that taboo of a lot of gay men living with HIV really want to talk about having children and their options. And, so for our sort of our other part of our community, in a way, it's just as vital that we talk about the things that we want to do. And it's not surprising, is it, that we hold ourselves back and we fear what the response will be. Although if we don't start talking, then nobody is necessarily going to start asking. So there's that as well, isn't there? So I'm glad we're talking a bit more about all of this today. Yeah. Anybody else have other comments on healthcare side?
Can I just add about family? Starting a family as trans, a non-binary person. That is very much for young people when they go to the Tavistock clinic, for instance. It's part of their assessment and part of the care that comes during assessment and afterwards as well, about what they want to do regarding being a parent later on, which is quite difficult for like a 16-year-old, 17-year-old, 18-year-old to think about, but it's definitely part of the conversation there. I think it's vital to know that, because there's so much around, this gender identity clinic and young people. These things are discussed and encouraged to be discussed.
Yeah, because you can't access hormone treatment unless you've discussed fertility options. So that is a good practice part of trans, medical healthcare, I guess. It's really good to hear, Delphine, your work with young people as well. So that's also very conscious. Like we say, there are really good examples, aren't there, of good healthcare, responsive healthcare. I know a couple of years ago, my partner was diagnosed with breast cancer, and I cannot fault the staff team around. I was around all the procedures, all the operations. They were absolutely lovely. Nobody ever made me feel like I shouldn't be included. They really did not it was just very, very affirmative, really affirming progressive care. So I felt like, I've had a really good experience, which actually means a lot, because sometimes in my life I haven't had good experiences, but it can be hard for us to remember, can't it? That, yeah, actually, we can be really human with each other and really affirming. And hopefully there'll be more and more stories like that, going forward as well. And sometimes at Metro, I think we hear the worst as well, because people come to us because they want extra support, maybe because something's happened. And so you do sometimes get a slightly skewed view as well. But okay, so I'm dying to ask this little question that I've thrown in here. So I don't totally know what it's got to do with sexual health and mental health, but I thought I'd ask it anyway, because I'm sure you can help me make the links. So I wanted to ask about experiences of spiritual health and well-being. So sort of like, in a way, the question might be like, what sort of connects you or sustains you? That's maybe a bit, it might be a bit less psychological, or a bit less sort of in your day-to-day life, or do you have a sense of your spiritual life as LBT women and non-binary people? And what, is that a taboo? Us talking about, say, religious and spiritual health, and if you could share something about your relationship with the word spiritual and what you think it might have to do with the issues we're talking about tonight.
So something I found is that often, particularly the idea of religion, I guess, rather than more than spiritual, the idea of religion and being LGBT are so often considered to be mutually exclusive. Having a religion and being queer. A lot of people. So my fiance's family are Catholic and are fairly devout Catholic, and she was raised Catholic, and a lot of people, when we talk about it, are quick to be like, oh, how are they? And again, they're really supportive, they're wonderful, they're incredible, I love them, they've welcomed me into their family as somebody who loves their child, and that's really all there is to it. But there's this assumption that because there's a religion attached to it, they must have had difficulty, or there must be a negativity attached to it, and there really isn't. There's nothing there. And so I think something I always talk to my young people about is that you absolutely can be religious and be queer. You can have both of those spaces and both of those identities, just like any intersectional identity where, people may be disabled and queer. Any of those things, you can be all parts of yourself in all your spaces. And if you don't feel like you can be, then we need to try and find you new spaces. For myself, I think something I always recommend, and I do think it counts as spiritual for queer people, especially queer people who are newly out, is finding queer spaces. I think finding other queer people to be around is such an enlightening experience, and is something that is so hard to put into words and so hard to explain to people who haven't felt that, who have, that alienation that you feel all the time, low key, that you don't even realize, and then suddenly you're in this space where you feel normal and there's so many people like you. I think I honestly consider one of the biggest spiritual moments of my life the first Pride I ever went to, because it just felt incredible. And it's something I always really advocate, is finding a space where you can meet other queer people. I guess also in terms of tying into like alcohol and things like that, I also think that's maybe something that we lack in our community, is dry queer spaces. And I think that's why so often we struggle with drugs and alcohol abuse, because so many spaces that are exclusively queer are bars and clubs, and that's, if we want to go and meet people, or go somewhere where we know we could hit on someone or ask for their phone number and we're not going to potentially risk violence or assault, the only place to do that is somewhere where there's alcohol. And I think we could do a lot for our community if we could make more dry queer spaces in general.
Great, thanks, Evie. Yeah, there's loads of really good points there, aren't there? And I had a real highlight when you said, going to your first Pride was a spiritual experience. I think I feel the same, a sort of, something else was happening then, not just the mundane, experience. And yeah, really important points, aren't they, about dry queer spaces, and given how many of our venues are actually pubs and clubs, and yeah, for obvious reasons, but it's so important to create a range of different, you know, avenues for us to be in relationship with each other, and to not forget all these other parts of us too. Yeah, it was quite poignant, I think, talking about dry spaces as well. Yeah. Delphine, Kyan, any comments about the spiritual sense?
Yeah, my first Pride, I was 38. And I went because of my kids, not because of me. But it was some sort of experience when I remember seeing a couple and they were both non-binary, and I just had this thing thinking, that can't be me, that can't be me, and then inside thinking, that can be me. No, you can't. No, you can. You can. You know, having this moment. So for me, it was like a moment of revelation, or whatever you want to call it. You know, thinking, okay, actually, yes. You know, why am I still, you know, why are the barriers to any of this? You know, why am I thinking that it's great for my kids to go that whichever route they want to go into, and then for me not to? I was like, well, what am I doing? So that was for me. Yeah, it's funny how you say first Pride as well. That really was. And I think spiritually, so I do a lot of Kundalini yoga, which involves lots of chanting and lots of kind of, you know, focusing on your body and your energy. And actually for me, focusing on the body has been quite a difficult thing to do, but actually appreciating the body and has been quite life-changing, really, and just being connected instead of having this repressed being about my sexuality, my gender, etc., but actually connecting to all those energies has been really amazing. And I think, you know, it's about queer spaces, you know, it's not all about bars and pubs and things. You know, I love mindful walks and foraging, which you can sort of do some groups doing like those things are amazing. That just, you know, but that can be queer based as well. We're just people as well, you know, we're just, that's it, you know, with different interests, and being out in nature as well. It's amazing, you know, reconnecting to, you know, our bodies and nature within nature as well. Just could be really amazing. So yeah. So like we need more of those spaces, definitely, because I think when I first came out, that's all I knew, you know, bars and stuff, and that's why I went into it. I just bought into it because I thought that's all there was. You know, if there had been alternatives, I would have, probably would have chosen alternatives to it, really.
Yeah, I've got that. A lovely sense of you on a mindful walk in the woods, Delphine, sort of nourishing yourself and your well-being. Yeah, I think it's so important, isn't it? And Kyan?
Yeah, I was going to say, I think what Evie said about queer spaces is really important. I think, so I grew up in pretty much the countryside, so like I didn't know many queer people growing up, and I think when I moved to London and went to uni, and I went to drama school where there were so many openly queer people making queer performance, and it being not just a thing that I wasn't just surrounded by queer people, I was surrounded by queer people who were being loud about it and who were celebrating and at any given opportunity, and there were so many opportunities to bring it up, and you didn't feel like you were, you know, and it was just amazing. So I think that was a big turning point, and it's a really, really good point that if you can surround yourself with queer people, it's amazing, fantastic. Also finding queer people who have different experiences to yours, I think, is really important. So I don't have a huge personal relationship with religion, but I met somebody who does, and who is a queer man, and was talking about the problems that he's encountered of being a queer person inside a religious institution, and how he separates religious institutions with his personal relationship to religion, and how there's problems with every institution, and he has a relationship with God and a relationship with his institution, and they cross over, but they're also separate, and how being openly queer in his church can kind of, he can hold them to account and he can help change things. And I thought that was really interesting, because I think quite naively I only had a somewhat negative perception of religion and the LGBT community. So listening to his experiences and how it's actually been for him was really interesting.
Yeah, I can remember myself years ago. I taught myself to meditate, and then I wanted to go on a course, but I didn't want to go anywhere religious, and because I was really, really worried as in my sort of late 20s that I would be somehow kind of caught by a group and then converted somehow. And I thought my queerness would have to go out the door somehow. And I remember I talked to a queer friend of mine, a woman, and she said, "Oh, why don't you go and learn to meditate at the Buddhist center?" And she said that it's full of queers there, and they won't try and convert you to Buddhism. You can just literally learn to meditate, and then you can do what you want with it. And she was right. You know, there was absolutely no pressure at all to sort of follow the Buddha's teachings, and it was a very sort of respectful and interesting course. But it could have been taught in a way, it felt a bit secular, the course. But what happened to me was I just got very taken by the atmosphere there, and that there were other queer people who had a spiritual life, and mainly that came to me through just talking to people, like in the tea break. That people were really nice, and they just talked in a different way than they did in a bar. So that was just a totally different flavour of kind of queer connection, and that's why I ended up eventually converting to be a Buddhist. So it is compatible, the religious life or the spiritual life, and being, from LBT women and non-binary identities. So, but yeah, it's interesting. I had a similar fear kind of thing as well, which, it's not surprising, is it? Given I was thinking the Church of England and the Catholic Church such a poor track record often of involving gay people, but also what can kind of happen is that in our community we can kind of bash religion, and then where does that leave people who feel spiritual and they want to nurture their spiritual life and they want to practice a religion? So I think there's some sort of bridges that we all need to sort of build. But yeah, obviously some religions are slightly more opening maybe than others in different places. Not that I want to suggest that Buddhism has the answer there, because it certainly doesn't, like any other, religion and place. It's full of patriarchy and, gender issues, and we're just people, aren't we? And we make up these institutions, so then things roll, they get acted out. So I like that idea, Kayan, of your friend who just wanted to make a difference by being an out queer person in the church. You can clearly see what a difference it makes. Yeah. Okay, so we are rolling into the last 5 minutes. Great stamina, everyone. I meant to say at past, we've got 30 minutes left, pause, have a breather. So maybe I'll just say, have a quick breather now, and then we literally will just capture the last sort of few bits and pieces. So I just wanted to point towards the chat. So anybody who signed up for this event on Eventbrite, you'll be sent, because we've got your email, but you'll be sent an evaluation form. And if you fill that in, it takes about 5 minutes. It'd be great, because we're always wanting to see how we've done and see, how we could improve. And so if you can fill it in and send it back, then it'll go into you'll go into a prize draw, and you'll have a chance to win a gift card for £100, which is all right, isn't it? I think it's all right for a 5-minute evaluation form. So do have a look at that. Okay, so I wanted to got a nice little message there as well from Alexander. Thank you. Thanks for being with us. So I wanted to just pose a sort of final vision, in a way, of like going forward, where we might be headed, and then I want to ask you to maybe just say one thing about how we could get there. So my impression of working with younger people is that they see sexuality and sexual orientation and gender identity in much more of a sort of spectrum way. They see it in a less binary way. They see it in a more inclusive way often, and they're not so sort of fixed and rigid. And you know, in a way, all our letters in our LGBTQI, you know, it's sort of it's beyond letters in a way. So I was thinking, you know, that vision of society, which is much more responsive, much more person-centered, and much more inclusive. You know, how do you think we're going to get there? You know, how do you think this young people's sort of vision of the way in which they're experiencing their identities and sexualities? How do you think we could get there as a sort of society and a community into a more just a more inclusive and welcoming? I mean, we all want to belong, don't we? So there's a sort of sense of, you know, how are we going to realise that vision of, you know, more and more of us feeling like we do belong, we are included. So just a small question to end on. And we've got about 3 minutes. So in fact, we've only got 2 minutes. So literally, maybe if you could just share a little bit of what do you think?
I'll go first and I'll be as quick as I can. So I think my biggest thing is that actually inclusion in terms of the space we're all speaking from can really start at home in our own community. I think we need to make sure that we are always addressing the racism and ableism and huge issues that the LGBT community faces, and that our spaces are not safe for everybody that identifies as queer, and that we need to make sure we are working on that in every space we occupy. But I guess as a broader concept, I think how we get there is kind of that overall, as a human being in any space you occupy, making sure that you acknowledge the privileges you hold and how you can use your space and use your voice to make that space an accessible place for other people who are more marginalised, who have voices that are spoken over. And make sure that you are always working to support other people to get to any privileges you yourself hold.
Nice, thank you, Evie. Yeah, lovely answer, thank you.
I will say, probably not surprising from a young person's sexual health worker, but I think more sex education. I think we need better sex education. We need more of it. I think it shouldn't just be, you know, if we can make it not just the responsibility of a couple of PSHE sessions at school and have it everywhere and open up the conversation, have it at home, have it like literally anywhere where it's relevant. I think that is super important, and that's one of the reasons, one of the ways we can kind of get to that place.
Thanks, Kyan. Yeah, great.
Yeah, Kyan, when you're talking about, you know, extending the spaces, I'm thinking about young people and coming to our service as well, and extending that service to families as well, and be able to support families, because you know, parents, siblings might not know so much, you know, and it's all about education again, you know, but having for them to have this support that we could have, that's my wishful thinking, you know, giving support to parents. And we do, you know, when with our young people, we have conversations with the parents, you know, we are not trained to get your child to be trans, you know, we are actually supporting your child in working out what they want, what they need, and questioning in a safe space, you know. So yeah, more safe spaces, more queer spaces are, like, you know, different from, and having young people experiencing not just, you know, going to clubs and pubs and things, and actually giving them, I'm not saying that they have to go foraging and do mindful walks, but do something, you know, with young people they enjoy doing, and using art. You know, I love using art in my practice as well, you know, at Metro, in my private practice, and outside as well. But just having something creative for our young people, just moving forward, having a new generation of people who are just not going to have to experience this horrible, you know, medical appointments and stuff like that. You know, just moving on, because they will be the future. So they'll be the ones who will be, you know, who will know, and they will be educated, and so that younger generation won't go through any traumatic experiences as well. Positive experiences.
Sorry to chime in very quickly. I also think we we don't place enough value on intergenerational spaces, and if we could have more intergenerational spaces within the queer community, but also just in general, I think that would, you know, bring a lot more change and be really beneficial.
Great, thank you. Well, I just wanted to, you know, really thank you all very, very much for coming to the panel and, you know, for sharing tonight. There's loads of comments in the chat, people really appreciating what you've shared. You know, I think for me, some of the highlights have just been how lovely it's been that you've been so open about your personal experiences. So, you know, that's really, really touched me, just your being so relaxed and being able to bring yourselves in. And I was thinking, if we are going to move to a future that's more inclusive and included, we just need to call each other in, don't we? And that's what we've done tonight. You know, we've just said, okay, how can we help each other, share with each other and share with everybody out there? And I think it makes a massive difference. You know, it is unusual still that LBT women and non-binary people share their experiences, are heard. And yeah, I just feel like it's been such an encouraging event and sort of panel to be part of. It's really given me a real sense that this is it. We are changing the sense of inclusion and welcoming. And yeah, I just wanted to really thank you all for that. And also I wanted to thank the LGBT consortium for helping organise and our planning team around the week. I wanted to also thank our colleagues in the National LGBT Partnership and our colleagues at Metro, and also the comms team, which have been doing lots of stuff behind the scenes, which just enables us to just be here and share and do our best. So really wanted to thank Sue and Tom and Mark as well from Metro comms team. And yeah, we're only a few minutes over, so we've done pretty well time-wise. And so yeah, if you want to unmute yourself and say bye to the folks that have been watching, that would be great.
Goodbye.
Bye.
Thanks for watching.
Thanks, guys.